70 years ago, a daring act changed medical history forever. A father's heartbeat became his child's lifeline. This is the incredible story of Dr. Walton Lillehei, the man who rewrote the future of cardiac surgery. In the early 20th century, over 40,000 babies were born each year in America with severe heart defects. Sadly, around 10,000 of them never lived long enough to attend kindergarten. But everything changed on March 26, 1954, thanks to Dr. Walton Lillehei's bold new approach. On that historic day, Dr. Lillehei and his associates, Morley Cohen, Herb Warden, and Richard Varco, took an unprecedented leap. They repaired a ventricular septal defect in a 3-year-old boy by using the boy's father to oxygenate his blood during open heart surgery. Before Lillehei's breakthrough, congenital heart defects were almost always fatal. Between 1952 and 1955, early heart-lung machines were tested on about 20 patients, and only one survived. Lillehei's method turned despair into hope. During the operation, the boy's blood was rerouted to his father's lungs for oxygenation, then pumped back into the child's body. This technique gave the surgical team a critical 19-minute window to repair the defect. Over the next 15 months, Lillehei and his team performed 45 surgeries on young patients, most under 2 years old, using cross-circulation. Their success redefined what was possible in cardiac surgery. However, the cross-circulation technique sparked controversy. Critics warned that using a living donor could double the risk, a potential 200% mortality rate when including both patient and parent. The risks were undeniable, but so was the potential. Despite the dangers, Lillehei's innovation opened the door to the modern era of open heart surgery. In 1955, Lillehei, Cohen, Warden, and Varco were awarded the prestigious Albert Lasker Award for their groundbreaking work. Between March 1954 and July 1955, 45 children, aged 5 months to 10 years, underwent open heart surgery at the University of Minnesota. Miraculously, every parent volunteer survived. Of the children, 20 became long-term survivors, many living well into their 50s and beyond. 11 of these female survivors later gave birth to 25 healthy children, free of congenital heart defects. Dr. Lillehei's achievements proved that even the most complex congenital heart defects could be repaired. He forever changed how surgeons approached cardiac lesions once thought impossible to treat. Building on this success, Dr. Lillehei and Dr. DeWall introduced the first clinically successful bubble oxygenator. Lillehei also pioneered the use of hemodilution and moderate hypothermia, creating the foundation for safer, more effective extracorporeal circulation. In 1957, working alongside Earl Bakken, the co-founder of Medtronic, Lillehei helped develop the first transistorized wearable cardiac pacemaker. He also designed 4 prosthetic heart valves, including models that evolved into the famous Lillehei caster and St. Jude medical valves. These innovations have since saved countless lives around the world. Dr. Walton Lillehei's contributions to cardiac surgery are legendary. Today, nearly 1,000 cardiothoracic surgeons across the globe trace their training back to his pioneering methods. He's rightfully remembered as one of the true immortals of surgery. Today, AI is revolutionizing cardiac care, just as Lillehei once did. With AI-driven diagnostics and predictive modeling, surgeons can now solve complex heart challenges faster, safer, and more accurately than ever before. The spirit of innovation that Lillehei sparked lives on, shaping the future of medicine.